Good afternoon, everyone. I'm Noah Wineflash, and this is MyLUA Health, a maternal care coordination service focused on early risk detection, engaging education, and providing a truly equitable maternal care experience. Today, I'm going to take you through our story and where we're at today. MyLUA was founded by CEO and CXO Javene and Ulia Santos, two Afro-Latina first-generation American immigrants. Javene served as Ulia's doula during her pregnancy, and after Ulia was denied a medical intervention during her pregnancy, leading to a traumatic birthing experience, they realized that something had to change. So they did their research. They found that the United States has the highest maternal mortality rate of any developed nation, and it's been getting worse for 3 decades. They learned that in New York City, a Black woman is 9 times more likely to die during childbirth than a white woman. They learned about all of the unnecessary and avoidable suffering and death that occurs in our maternal care system currently. So they founded MyLUA, named after Alua, Ulia's daughter, because MyLUA's mission is simple. No parent should feel unsupported during their pregnancy. But currently, many providers lack the time and capacity to collect key data to provide that support. And what are those key data? Social drivers of health and mental health needs. It's estimated that up to 70% of health outcomes are attributed to social drivers of health, things like food insecurity, housing security, and social support. However, less than 20% of parents are screened for social needs or mental health needs during their pregnancy or postpartum. This leads to an estimated $3 billion in avoidable cost every year. And health plans are going to need to start collecting this data, as CMS has mandated its collection starting in 2024. However, many insurers lack the infrastructure and personnel to collect this data. Enter MyLUA. MyLUA has 4 pillars of support to provide more effective maternal care for parents and lower cost for health plans. First, early risk detection. Our patent-protected model detects postpartum depression with 94% accuracy as early as the first trimester, the earliest on the market. Second, automated data collection expands case manager bandwidth for health plans and health organizations. Third, engaging education improves health literacy and patient activation. And fourth, culturally congruent peer support ensures that all parents truly feel supported throughout pregnancy and are directed to the community resources to fulfill their needs. All of this creates a powerful engine to ensure better outcomes for parents and lower costs for health plans. Our education is different from traditional healthcare education. These bite-sized videos made by maternal provider experts and health equity experts are focused on the most pressing concerns for parents throughout pregnancy and postpartum, and provides actionable insights to all parents regardless of educational outcomes or background. And here is where I would play a video if that were allowed during this presentation. Looking at our overall traction, we have had buy-in from a lot of really great partners, including this esteemed institution surrounding us, as well as the National Institute of Health, which just awarded us their interim funding grant, as well as other health organizations, including Trinity Health and Ascenda. We also have been forming partnerships with governments at local, state, and federal levels to expand MyLUA access, and are currently conducting pilots with multiple health organizations, and are in talks with a potential first paying customer. It's been an exciting few months for us, and we have buy-in from some very important and powerful stakeholders. We expect to reach 20,000 engaged maternities by 2025 and expand our risk detection models to include other costly complications, including preeclampsia and gestational diabetes. Looking at the market on the whole, assuming about $500 per pregnancy as a conservative estimate, just in our beachhead states listed above, there's a market opportunity of $600 million per year and $1.8 billion in the United States as a whole. And this is only looking at engaging for pregnancy, but we are well positioned to expand into infant care and other women's health issues. Our team is made up of experts from in and outside of the healthcare industry. Our CEO has years of operational experience in healthcare, and our CTO already has a successful exit under his belt. Our advisors are made up of current and past providers, healthcare executives, and chief medical officers, and are some of the foremost industry experts on things like Medicaid, health equity, and maternal care, and more. I'm so excited to be part of a team that is working on such a pressing issue and is made up of so many superstars. If you're interested in joining us or can connect us to any relevant stakeholders, please let me know or connect at our website. I'm excited to answer any questions you guys have. Thank you so much. I'll stay up here.
Hi. Thank you for that. That's great. So can you say a little bit more about how you are or envision acquiring customers and what's the revenue model?
Yeah, absolutely. So obviously things were cut for time. So we initially are going for an implementation fee with a monthly fee based on the number of engaged maternities, moving to a per member per month model once we have cost savings validation, and that will be tied to key performance metrics. So essentially, if we are able to meet certain engagement rates, if we're able to prove that patients learn certain key actionable pieces of data from us, those will be the metrics that will either increase or decrease the revenues to ensure that incentives are aligned for health plans. And we're mostly looking at managed care organizations that serve Medicaid populations because our goal is to provide these services to folks who otherwise wouldn't be able to get them. So there are individual to consumer models for this type of education, but the people that we're really missing and are falling through the cracks are these underserved Medicaid populations.
Can you, thank you so much for your presentation. Can you talk a bit more about, so you talked about the maternities, you talked about health plans. Can you just to me talk a little bit more about go-to-market? Because part of it's like if you sign a maternity, you have to also, there's like a B2B component, but then you have to also get the people to use the system and fill the data in. So can you talk a bit about how you make that happen?
Yeah, and so that's part of why our partnerships with governments and community organizations and also providers are really important moving forward, and something that we are forming in our initial pilot areas and beachhead states. So essentially our plan is to have as many touch points as possible. The health plan will be attempting to onboard customers, but then also working with providers that commonly serve those customers. And the provider's interest is also aligned because their patients are more informed, they feel more self-efficacious. And so also partnering with those providers, they're not paying us money, but they are providing the QR code to onboard those patients.
Where does your model leave off? So does your service end at the birth, or does it continue on through postpartum?
Yes, postpartum care, especially because now Medicaid has extended in a lot of places to cover 12 months postpartum rather than just those first 3 months. That's an important part of the care. And in maternal care, a lot of where negative outcomes come is during that 3 to 6 month postpartum period. So we're still monitoring them, still ensuring that their mental health is doing well, and ensuring that infant health is also doing well.
And do you connect people to services and providers? Is that part of the program?
Yes, so a big part is coordinating with resources that already are in their communities or that the health plans already have in place, and ensuring that their needs are actually addressed. So just identifying those social needs aren't enough. You need to actually go the step further and connect them with those resources. And that's the other place where building out these local connections is so crucial for us and has been a big undertaking over the past few months and will continue to be.
Thank you for the presentation. I might have missed it, but do you mind just telling us a little bit about the competitive landscape that's out there right now, if any?
Yeah, absolutely. So in general, there are a few newer startups who are positioning themselves in this equitability lens. There's organizations like Ovia that also provide this reproductive education, and a bunch of other services that work in that. Most of them don't have this early risk detection tool, and also few of them are looking to integrate with health plans. So a lot of them are going after providers or direct consumer, and the ones that are integrating with health plans tend to be either solely equity focused and just looking to serve specific Black parents or Asian parents, Spanish speaking parents, or they are focused on this early risk detection and kind of the marrying of those two to detect the risk and then provide culturally competent support is kind of where our wedge is.
Thank you. And is the early risk just for depression, or is it screening for other potential medical issues?
Our risk score right now is just for depression. We have on the roadmap to expand to other common complications, but our risk screenings detect other social needs and other things that do need to be addressed and can improve health outcomes by being addressed early rather than waiting later on until they become a problem. Thanks, everyone.